Welcome to Cancer Care Services Just the Facts program. Today, we will be discussing community health workers as a health equity solution. I am Melanie Wilson, and I am the CEO of Cancer Care Services, and I'm honored to have you with us today. For the past 75 years, Cancer Care Services has existed so that no one has to cope with cancer alone. We provide free cancer support services to everyone in Tarrant County. We do this by walking beside cancer patients, survivors, and their caregivers during their entire journey because we want to limit the impact that cancer has on their financial, emotional, and day-to-day well-being. So before I introduce today's topic and speakers, I have a few quick Zoom housekeeping notes for you. Attendees can't be seen or heard. Although chat has been disabled, you can use the Q&A to submit questions for the panelists. We'll have 15 minutes at the end for your questions. There's also an option for live transcription if you'd like. To turn it on, click on the live transcript button at the bottom, then click show subtitles, and you should see subtitles at the bottom of your screen. So now let's talk about why we're here today. Did you know that cancer is the leading cause of death in Tarrant County? Did you know that those living in poverty have a lower survival rate for all cancers combined? Did you know that African Americans have the highest death rate and shortest survival of any racial and ethnic group for most cancers? And did you know that cancer is the leading cause of death among Hispanics? So these sobering statistics are examples of health disparities. But there is a health equity solution, and that is community health workers, which is why we're here today. The commissioner of the Texas Department of State Health Services considers community health workers an essential asset in Texas health. Community health workers, informally known as CHWs, have proven to be successful at increasing health outcomes because they have a deep understanding of the cultural norms and language of the communities they serve. This is why Cancer Care Services has expanded our staff to include 2 exceptional community health workers, and we are currently interviewing for a Spanish-speaking community health worker. So now let me introduce you to today's amazing speakers. Our first speaker today is Lisa Padilla. Lisa is a community change agent who's worked tirelessly in the field of community and public health in North Texas for the past 25 years. Social justice and equity are at the center of Lisa's approach to programming. Lisa has a Master of Arts in Human Behavior and Development, and she recently joined Cook Children's as their manager of community marketing. Lisa is also the board president of the DFW Community Health Worker Association. Now I'd like you to meet James Earl. James is Cancer Care Services Director of Outreach and Health Equity. James holds a bachelor's degree in social work and has a master's of public administration. James's passion for oncology social work was shaped by the loss of his mother and grandfather. So James is a wonderful leader for our community health worker team. And thanks to their combined dedication and efforts, Cancer Care Services was recently selected as the Organization of the Year by the DFW Community Health Worker Association. We're so proud of that. So in addition to James, I'm also honored to introduce another member of Cancer Care's family and a member of our outreach and equity team, Carlene King. Not only is Carlene a community health worker, but she's also a long-term volunteer for Cancer Care Services and one of our most passionate advocates. And finally, Denise Hernandez is the Executive Director of the DFW Community Health Worker Association. But sadly, Denise is unable to join us today because of a death in her family. Please keep Denise and her family in your thoughts. And now I would like to turn today's discussion over to our experts, James, Lisa, and Carlene. James, let's start with you, please.
Thank you, Melanie, for those fantastic introductions. And I want to start off today's discussion by just getting a read on everyone's knowledge of what a community health worker does. And so we're going to take this time for a brief poll to see, do you know what a community health worker does in a community? So if you can just take this time to give us your responses, and then we'll kind of dive into today's discussion. We have 6 responses so far, 7. Good, good. Looks like we have an opportunity to educate you guys today. Love it. Great. Okay. Just waiting on the last 2 responses, if you care to share. Okay, so let me go ahead and share the results. It looks like we have 25% of our respondents said yes, 13%, one person said no, and then most of you have an idea but need a little bit of clarification. So I think that's a great starting point for our discussion today. And what I'm going to do, Carlene, Lisa, what I would like for you ladies to do is define what is a community health worker and what makes them so unique. So Carlene, we'll go ahead and start with you. You can bat it off to Lisa after.
Okay. All right. Good morning, everyone. The community health workers, what we do, we are the frontline advocates for the people in our community. So basically, we're the voice of public health, if you will. We provide resources to those populations that may otherwise not be able to or not have access to care. And therefore, they may go without, screenings and different medical procedures that they might need. So we are that very important piece of the puzzle to go between the doctors and the communities who are in need, but may not otherwise hear about assistance that they may have.
Okay. And Lisa?
Lisa?
Yes, thanks for that, Carlene. And I want to start by saying thank you, guys. Thank you, Melanie. Thank you, Cancer Cares, for having this most important conversation, especially today, much needed, right? So thank you again for inviting me to take part in this. So kind of expand on what Carlene said about CHWs. Oftentimes CHWs live in the communities that they work in. Kind of the actual definition for community health workers are they're a trusted individual who works in public health, and they know resources and they know the communities that they work in, right? And that's kind of the simplified version, I think. In actuality, they're very trusted individuals. They work for trusted organizations. And they help build that trust, right? We look and sound like the people that we work with, like the clients that we service. The other piece of this that I want to mention is that even though the title is community health worker, right? And in the state of Texas, when you go to the dshs.texas.org website to find out more about CHWs and the certification and CHW instructors, which I hope that you all will, go to do some additional reading, you will also see that the name is Community Health Worker / Promotora, right? So that is kind of the historical view. The CHW started many, many years ago. For a long, long time, Promotora CHWs worked uncertified, but we are usually the community advocates, the frontline folks in the community that are ensuring that residents, community members have knowledge about some resources that are available for use. So again, the frontline worker, I think, is a good way to approach what a CHW is. And while the health piece is in the title, I think it's important to say also that CHWs have just as much impact and work very well in the health field, obviously, but in social service, in education, anywhere where there is a connection with people, you can employ and have CHWs and have them make an impact for your organization.
Man, that is great. Thank you for that overview, Lisa. What I'm curious about, Carlene, is how do you, as a community health worker in a community-based organization like Cancer Care Services, how do you make an impact? What stories could you share with our audience that can really give them a quantifiable idea of the impact that you're making on a day-to-day basis?
Well, I can think of a couple of things. First off, we have to remember that the communities that you find the community health worker in most time are the African American Hispanic communities, underserved, fearful of the medical system for various reasons. With the African American, we all know that, there were the Tuskegee experiments. The Hispanic communities, you may find someone that's undocumented. And the last thing that they want to do is alert anyone to their status. So as a community health worker, we're out there being that trusted voice, basically. So we're meeting them where they are and allowing them to verbalize their feelings or tell us about what's going on with them. And we can give them the calm and the confidence to seek medical attention. One of the things, we're just there to listen. There may be misinformation out there. A lot of times they're like, well, I don't have insurance. I can't afford to pay for medication. Well, I have to take care of my family. And so a lot of times I'll ask, okay, if I can give you information on where you can go to get your cancer screening, and you don't have to pay for that, then what excuse would you have? And then it's, well, my kids, or I have to take care of my family. But the next question is, what if something happens to you? Then what happens to your family? And with that, if they know now this person cares, there are places that I can go to get a mammogram or a prostate exam, or whatever it may be. I don't have to pay for it. I don't have to worry about anybody turning me in. And this organization isn't one that is trying to do some sort of testing on me or something like that. Now they're comfortable because they're like, okay, I can get my health taken care of. There are resources that now my stress level goes down because I don't have to worry about where am I going to get the money to even buy medication, or how am I going to get to a treatment. So we're able to calm people down in that way by providing the resources that we have. Or just to be that sounding voice. I had a lady who was in a line at a food pantry that I was helping at. And she had, just in giving her information about cancer care services and the services that we provide, she opened up to tell me that she did know about the organization, which that was a good part of it. But she also said, I just lost a very close friend just this past Sunday. I also lost a brother. They both had cancer. They both contracted COVID. And someone told her that because they had cancer, it was 100% guaranteed that the person is going to die. So basically, anybody with cancer at any point and you get COVID, there's no hope. So the purpose of what we do at Cancer Care Services, as well as community health workers, we're there to provide the hope that people need. And just by being able to reassure, this young lady kind of calmed her fears, and she did thank me for that. So could she have gone to a doctor and expressed that? Probably not.
That's a great point, Carlene. And what really stands out about community health workers to me and what makes them unique is their agility, their ability to meet people in the community where they are, and be responsive in the moment to the various needs that they may have. And Lisa, I'm interested in hearing from you. In what ways do community health workers help remove barriers to accessing the healthcare system, and allowing those that are disproportionately impacted by cancer or other chronic diseases? How does that work, based on your experience?
Well, goodness, that's a really good question. And I think, as we look at the field of CHWs and all the ways that we impact health and social service and the communities that we work in, I think it's a combination. I think it's a combination of that relational piece that Carlene just talked about. And then the CHW also having, while we're able to relate with our communities and clients, we also have some type, usually, of a lived experience, right? And I think that a lot of times that opens the door to additional knowledge about resources that are available, because we've kind of been there a lot of times and done that. We know most times how individuals want to or need to hear certain information, right? So while I've never personally been impacted by cancer, people in my family have been impacted by cancer. So I know firsthand that once you get that diagnosis, right, it's like all else goes out of your head, kind of don't hear anything else. So to have someone come in beside you, the CHW, right, the most important piece, that's going to come in on your terms, and a lot of times do a home visit, do additional phone calls, do additional meetups in the clinic. We talk to those individuals before they go in and see their medical providers. So all that extra, because it is an added extra that we give to patients and clients before they get into the systematic pieces of social service and healthcare, right? I think that's a confidence booster. It's a knowledge piece. We educate, we do outreach. We keep abreast of what's changing in the community, because it is ever changing, so that we can easily try to relay that information to clients and patients. And I think that's what really makes the impact. While providers and clinicians are busy trying to get that real stock information and diagnosis and treatments out a lot of times, we again come up on the side and are kind of there, the voice for folks, and all those extra things that they need to be able to then manage their disease accordingly, feel better about, conditions and diagnosis that they have, feel more empowered to handle those diagnoses at a different level. So that's just a little snippet of the many ways that we impact.
Yes, and my apologies. Give me one moment. I'm having some technical issues. I need to go downstairs and grab the charger for my plug, and I'll be right back. Melanie, Ray, if you guys care to take over in the interim, I will be back in just a short second.
Sounds good. Sounds good. Technical issues in this day and age. What would we do without them?
Yes, that's one thing that we have learned through Zoom is that anything can happen at any time. So thank you all for your patience. So one, as the leader of Cancer Care Services, for many, many years, we've been aware that there are communities that do not have the same access to healthcare and the same resources. And before we had community health workers, we really kept trying to find innovative ways to really connect with other populations, and very few of those efforts were successful. And so the community health worker model, I can just say from my perspective, I have seen such impact in a relatively short amount of time when you hear stories about Carlene being at a food pantry and being able to have natural conversations that are not intimidating and not in health setting. So I just really, that's not a question. It's more just a moment of gratitude to thank you all for pursuing this field and for following your hearts and doing what you can to reach those who often can feel very disconnected and helpless. So really just a moment of thanks. So James, I see that you're back.
Thank you so much, Melanie. So Lisa, one of the things that stood out to me in our last question that I gave posed to you was relationships in lived experience. And, working with Carlene very, very closely, she's very good at establishing relationships. She can talk to any and everyone at the drop of a hat. And then also her lived experience as a breast cancer survivor. So, Carlene, the question I wanted to pose to you is, how has your lived experience as a former client of Cancer Care Services, a breast cancer survivor, how has that experience allowed you to really, really connect with those who are going through cancer in some of the communities that we've served? Could you, before you answer that question, I want to know a specific example. I want you to really get to the heart of it, like a really great example of what that looks like for you.
Well, first of all, let me apologize because my lawn man decided to come now. So maybe a little bit of background noise. But I am a 13-year breast cancer survivor. And when, had I not had cancer, then I wouldn't be doing what I'm doing now. Definitely. Because while I was going through that treatment, I ran into several people just sitting in the chair at the oncology, the infusion center, who were having to, sell cars because they couldn't afford to pay for medication, or they were having trouble paying their rent. They were, should I buy medicine or should I get food? And there was just so many things right there in that moment. And I was that person that felt that social service organizations by tradition are looking for people who are pretty much destitute, could not take care of themselves, had, pretty much nothing. So I was not the person that was going to reach out to any organizations for any reason. Cancer Care Services had a social worker who was at the oncology clinic that I was going to, who repeatedly told me about Cancer Care Services. And I repeatedly said, no, thank you. I don't need any assistance, until she told me about getting massages, which had nothing to do with income or insurance or any of that. And so all of a sudden I would go into cancer care. And when I get there, I find out that they will try to help anybody. So whether you have insurance, you don't have insurance, you have an income, you're not necessarily struggling. But what I was told, that was because I was self-employed, I'm technically going to be unemployed when I get through these chemo treatments, because I'm not going to be able to do what I'm used to doing. And with that, I went in and, they were, paying my mortgage while I was in treatment. They were giving me money for medication, just different things. And that prompted me, because I had heard these people talk about how much they were struggling. And the first thing out of my mouth was, have you not heard of Cancer Care Services? And it just amazed me that people had no clue what was out there. So because, as James said, I'll talk to anybody. I'll talk to a rock if it listens to me long enough. But, the first thing I'm like, okay, well, there's this organization over here. They might be able to give you some help. I didn't know exactly everything that Cancer Care did, but I did know what they did for me. And that was all the nugget that I needed to get out there and start talking to people. Because for me, to see somebody struggling with something that they don't have to struggle with makes absolutely no sense. So, I would just start telling them to call. You don't have to know what you need. When you get over there, the social workers will figure it out for you. And that's basically my speech even today. People will say, well, I don't know what I need. I don't know. Okay, you don't have to, just call.
That's fantastic. So, Lisa, what ways do you see CHWs making an impact for at-risk populations specifically? I know there are different CHWs in different community settings, but based on the setting that you're in, how do CHWs make a positive impact?
Well, my goodness, another good question, but I think that while there are many answers to that, I think the one that I can zero in on right now is just that connection to resources, right? Connection to resources, and who knew that the connection to the lived experience is going to be so important and play such a role in what we do, right? So again, Carlene has spoken about kind of what makes her impactful. And it is that peer-to-peer, aspect of what we do. A lot of times, there's no different or better verbiage than, a lot of times we've been there, done that. While CHWs come with many titles, sometimes we actually get to work as CHWs, right? But a lot of times our title is an educator, or a peer counselor, or a navigator, or a teacher, right? Or a police officer, or a social worker. So that's a good thing about the state of Texas, is that our CHWs come in all shapes, sizes, histories, degrees, non-degree, volunteer, paid work. We have CHWs that look, we obviously, we all look like the people that we service. We sound like them. And those things, they do make an impact when it's about the interrelational piece, right? So I think that those things just help in us getting our foot in the door. right? So it's about getting your foot in, building a relationship, and then keeping up what we know to keep up, right? Our knowledge about community resources, our knowledge about the communities that we work in. Ideally, a CHW lives and works in the same community, but that's not always the case. And I will reference one hospital, large hospital system in Texas that has the largest, probably the largest CHW workforce in Texas. I guess that's okay for me to say, Baylor Scott and White. So they employ, just in North Texas, they employ over 100 CHWs. So they're seasoned. They have leadership buy-in. They've been through a lot to get their program where they're at, but they specifically have one navigator program that prefers to hire CHWs that don't live in the communities that they work in. So it depends on, what the goal is, where you're trying to get, the folks that you're connecting with. So there's so many different ways to kind of answer that. And I do want to address also, we have a question in the chat about some research that exists on how impactful CHWs are in reducing disparity. So obviously I just went over kind of our experience, right? But some of the research is widely available at this point. You can get on and do a scholarly search on the impact of CHWs in reducing disparities or impacting health outcomes. You will find both. PCORI has done and funded a lot of programming. CDC website and the WHO website have a lot of information, and you will, if you go onto those websites, along with the state of Texas, the DSHS.texas.org, you will also find a lot of research. We have CHWs at this point have a plethora of research behind it.
And just to add on to Lisa, also the American Public Health Association has research regarding CHWs, and the National Institute of Minority Health is a great resource for the impact of CHWs. Okay.
Yeah.
Next question, Carlene. So take me into a day in the life of a community health worker at Cancer Care Services. Give the people an idea of what your day-to-day looks like.
Okay. Well, it can be pretty hectic. There's no real organization because we have to sometimes move on a whim. But basically what I will do is I go out into the community. I can just do, drive-bys, and I'll see an organization or a doctor's office or dentist that I'll stop, and just go in, introduce myself, and ask them if they've heard of Cancer Care Services. Unfortunately, with our organization being 75 years old, we still get a lot of, I've never heard of the organization or the services. And so that's when, I automatically go into a different mode, because the goal that I see is that, one day, really soon, we'll never hear that particular answer again. So it's about just going out there and, just making cold calls, I guess, if you will, just stopping into different organizations. And sometimes we'll find organizations that we say, hey, that would be a good community partner, because they're dealing with people in the underserved communities as well, but they don't know about the services that are available or the resources that are available for cancer. And they have people who are dealing with the cancers, and they have no clue where to send them. And so that's the whole purpose of, being out there. I, just get out. I talk to people in the community. It can be someone on the street if I'm, at a park or something. Just wherever I can find people or organizations that look like we could get plugged into. That's what I do. I invite them to tours so that they can learn more about cancer care services and the work that we're doing. So basically it's, out there on the phone calling. I may look through a magazine and see, an organization that I think would be a good place to reach out. So there's no real organization per se. We just get out there and do whatever needs to be done. And a lot of times it's, just fly by the seat and it works.
Yeah. So Lisa, you and Carlene both are on the board for the DFW Community Health Worker Association. And of course, Cancer Care Services was awarded that honor this past year. Tell me, what is significant about Cancer Care Services receiving this award? What did you see in us as an organization that made us such a good fit and such a good recipient for this award?
Well, yes. Annually, we do, the DFW CHW Association does an annual conference. So part of our conference is to highlight and choose an organization that will be our CHW champions and organization of the year. This year that was Cancer Cares. We also highlight an individual who has gone above and beyond in the community, just doing the everyday CHW work that we all do. So part of the reasoning behind choosing Cancer Cares this year was that Cancer Cares really, I think, is the epitome of how, in a perfect world, whatever that is, right? We would like to see an organization take on what CHWs are, what they do, and how they impact, right? So when I came to Fort Worth to work, because I actually live and have worked the other history that I have in Dallas, I was new to Tarrant County, and I came to Cancer Cares and I sat down with Melanie, the CEO, and we had a good conversation about everything that you guys have to offer, right? And we had that very first conversation, we talked about CHWs, what they do and what they bring to the table. And I saw the transition after that, right? So I think that the most important thing for capacity building right now with CHWs is the capacity building, right? How do we build that? How do we integrate it into our workforce? If we are a clinic, if we are a social service agency, whatever our operations are, how do we then integrate the work of the CHWs and the competencies that they offer the clients that we serve? And I really saw that come to fruition, I think, with Cancer Cares, and not only myself, others on the board, others in the community. We have a long line of community partners, and we all kind of talk, amongst us, and who's doing the good, solid work, who has leadership buy-in, who is not. Sometimes it's not about, oh, I'm going to bring in 100 CHWs this year, right? It's not always about that. It's how are we taking steps to build this, sustain this, make it really work for our clientele, and make it work for the community that we're servicing. So that's the main reason that you guys were chosen this year, is because of the good work that you're doing in this field specifically.
Thank you. And Carlene, I know we're kind of coming close here, but give me let's give the people a few highlights of our outreach program here at Cancer Care Services. What are you most proud of as a CHW here at this agency, and how we've integrated this profession into the workplace? And you can share that by giving us just a few highlights.
Well, I think what I love is that this by Cancer Care Services now having community health workers on staff. Now there's a huge presence, boots on the ground for this organization, which is very, very important. And by having that presence in the community and the community not having to travel over to our office, they're seeing Cancer Care as an organization that is willing to go out of their way to come to them and to help them and to seek them out. So that makes a real difference, in my opinion, is that, people are not having to, one, be told that they have cancer and then have to go and figure out, what do I do next? But by Cancer Care Services actually being out in the communities, people will remember, hey, I saw Precious or I saw Carlene. I just got diagnosed, or somebody that I know. So what are they going to do? When we're out in the community, they trust us already because we've already been out there. And so different people are going to call. I got a phone call the other day from someone who came to a community conversation that we had pre-COVID. The lady said, oh, well, Miss So-and-so referred me and said that you might be able to, give me some help or point me in the right direction. And mind you, this was over a year ago, but people remember because Cancer Care Services cares enough to come to us to help. So without the community health workers, nobody would have the opportunity to actually get out in the community and spend time building that relationship with the community.
Yeah. And what I would add to that Carlene, is what's been so fascinating about the integration of community health workers into our organization is the educational component and wellness wisdom. Now I don't want to steal your thunder here with wellness wisdom, but I'm interested in hearing your perspective on the impact of this program. What is wellness wisdom, and what do you see that we have accomplished through the implementation of this program?
Well, wellness wisdom is my baby, right? So that program is designed to help the community to be able to speak up for themselves. That's our whole goal. Is we're advocating for them, but we're also teaching them how to advocate for themselves and for, their family and other people that they care about. So the importance of that is that, one, we're teaching them about, the medical billing and how to, kind of navigate the whole process. We teach them about insurance, helping them to understand the insurance, because a lot of times when they're in the doctor's offices, everything is 12 feet above their head. They don't understand the terminology. They don't understand, what you just told me about my copay and all of this stuff. So wellness wisdom is breaking that down into layman's terms, basically. So now they can read their billing statement, to know what they're being charged for. They know that it's okay to question, the charges that you receive. We also teach them how to talk to their doctors, because there is a way to approach it. And I have talked to several doctors when I'm talking about the program and promoting the program. And the first thing that they say is, we would love to have patients that come in and we don't have to spend so much time trying to get information. So when we're teaching them in the Wellness Wisdom Forum, know your family history, keep a list of the medications that you're taking. So you're not sitting in the doctor's office saying, I think, I don't remember. So, these things are important to the doctor. So if they're with a list, they're taking notes as the doctor is talking, then now some of the health barriers that we've seen kind of go away, because you have to think that person who's engaged in their own health, the doctors are going to pay more attention to right off the bat. So the people that are in the communities, people that have attended these sessions, they are so appreciative because they're like, wow, nobody ever told me that before, or I never thought about that. So, wellness wisdom, like I said, the whole goal, we go over the financial piece. We talk about how to talk to your doctor. We talk about the mental health aspect. And we also talk about the caregiver, which that caregiver going through cancer, most people normally focus on the person with the disease, and they kind of push the caregiver to the back burner. And who's the person that you think will probably have more stress? It's that person who's now not only having to take care of their own life and the problems that they had, they're now having to manage the life of this person with cancer. So we make sure that we focus on, the whole family.
Thank you. And so we have about 15 minutes remaining, and I want to open the floor to our panelists for a couple of questions. It looks like we have 2 questions so far. And the first question is, have the roles of community health workers changed over time? And are there community health workers for disabled or LGBTQ plus communities? So Lisa, Carlene?
No, I was just going to make one real quick. As a community health worker, it doesn't matter who you are. We're about one thing. We're about the person. So, I don't care if you're Black, brown, purple, LGBTQ, what, it doesn't matter to me. I see a person. So I'm not focused. It's kind of, like if you own a store, are you concerned about that person, or are you concerned about whether or not their money is clean? I'm concerned about the person that needs help. So Lisa, you can add to that.
I will kind of piggyback on that a little bit and just say that it is within the code of CHWs and our kind of the ethics that we practice is, does someone need resources, information on resources? Do they need healthcare? Do they need education? Regardless of anything else that's going on around that person, that's what we center in on. There is actually for disabled and LGBT plus communities, they may not be called CHWs, right? They may be called the peer counselor or the navigator or the educator. But they a lot of times have this certification and they are practicing the promotora approach and are utilizing the competencies. The other question that Devin asked, as you alluded to, have the roles of the CHW changed over time? Drastically. And so that's the short answer. Kind of to expand on that a little bit is the CHW roles have changed because the community has changed. So that is what makes the CHW is so important in every approach to everything, right? Because I'm convinced that the CHW role is the answer to every ill out there. But as communities change, as people change, as needs change, the community advocate, the educator, the peer, the CHW, their concept of what is needed is going to change also. So the roles have changed drastically. We have a long, long history internationally, not just in the United States, up to our current certification process in Texas. That is changing, again, because of the community change. So
yeah, and I think a great example of that, Lisa, is in how the CHW industry has changed is their response to COVID, and how they've been able to adapt and be agile in response to COVID, and kind of as we look at opportunities for expanding our education on cancer. in the community health worker industry. I see that as another opportunity as well. And so I would like to, say thank you guys so much for the knowledge and the education and the thoughtfulness in letting us know, how CHWs are at the forefront of those equity solutions and addressing disparities within our community. And so I'm going to go ahead and pass it off to our fearless leader and CEO, Melanie, to kind of tie and put a nice bow on things, as we close it out.
Well, thank you so much for sharing your expertise and, even more importantly, your passion. Lisa, James, Carlene, it is so clear how much each of you genuinely care about reaching those in our community who have the greatest needs. And honestly, the work that you all are doing is making such a profound and powerful impact. And I'm incredibly grateful to you all and to all the people that you're inspiring, not just today, but even new community health workers who may, or people who might be interested in the field because of today. So thank you. And so I'd also like to thank all of you who have joined us today. Your interest in health equity truly gives us hope. So today's Just the Facts program is the second in an ongoing series. So please stay tuned for future invitations. And if you have topic ideas, we'd love to hear from you. So thank you again for spending an hour with us today. And if you'd like to know more about Cancer Care Services and the programs and resources we provide, I hope that you'll visit our website, which is cancercareservices.org, or give us a call. And we just love to help in any way that we can. So thanks again, Lisa, James, Carlene. Thank you again for being with us today. Be well. I hope to see you at our next Just the Facts.